Good evening, I'm Katerina Georgieva. Here's what's making news right now.
If you look for reasons why this might be, I think, a lot of this will be left to the epidemiologists after the fact to sort of do a post-mortem analysis of the whole pandemic. But I think vaccination rates have a lot to do with it.
The fitting my family into the leftovers from work is something that I really want to change, and I want to fit some work into the leftovers from family. And I'm getting to that age where it's time to start thinking about what the next chapter of my life looks like.
I think if you take out the word legal cannabis stores and enter sort of bars, restaurants, coffee shops, convenience stores, take your pick, there is lots of density of lots of different kinds of retail and lots of different kinds of places.
Thanks for joining us. Windsor and Toronto don't have a lot in common, so it came as a big surprise when provincial data was released showing death rates linked to COVID-19. More Windsorites lost their lives during the pandemic per capita than almost anywhere else in Ontario, second only to Toronto. Our Carrie Breen wanted to know why our city was hit so hard, and she joins us now. Carrie, just how bad did it get?
Katerina, this is not a great place to come out on top. But when you look at the death rates of all 34 public health units in Ontario, there's Windsor, second only to Toronto. 464 people in Windsor, Essex have died from COVID-19 since March of last year. According to provincial government records, the local COVID-19 death rate is about 110 deaths per 100,000 people. What that means is that for every 1,000 people who live here, there's been one death. Only Toronto's rate of fatalities is higher at 117 deaths per 100,000 people. These numbers made me ask, what's so different about our region compared to the others? And the top doctor in Windsor, Essex says there's a few factors that may be contributing.
Death is likely, as a clinical outcome, is likely a function of the number of people who are infected. And so Windsor, Essex has had a disproportionate number of people infected, and therefore you would expect that you would have a disproportionate number of deaths.
Nessa Thury says that Windsor has an older population, and another potential factor is the effect of low income on health. When I spoke to the health unit CEO, she told me that people in Windsor have high rates of chronic conditions, so when they get sick, potentially they can get really sick and are at risk of dying.
I do know that COVID-19 age is one factor, but also other chronic conditions is another as it relates to poorer, more severe outcomes. And we do know in Windsor, Essex, we do have a higher burden of chronic disease compared to the province. And in particular, when we look at all cancers, cardiovascular disease.
So, Carrie, those numbers that you shared, they look at the death toll going back to the beginning of the pandemic, but how are things looking now?
Right, yes. So the good news is that Windsor, Essex has never again seen the death toll rise as quickly as it did last winter in the second wave. That's when outbreaks hit many long-term care and retirement homes. Right now, cases are dropping, but experts are still worried because people here are still dying. Just over 24 people have died since September 1st. That works out to about one death every 2.5 days. One of the doctors who treats COVID-19 patients is calling on residents to roll up their sleeves so they can reduce the chances of ending up in hospital or dying.
Yeah, so my anecdotal experience is that the winter was quite difficult for us in the intensive care unit. There is a concern, as we head into to this winter that we could see the similar sort of thing. Obviously, the vaccine is the number one thing that has, prevented that or blunted that rise in cases. And so, my message to friends, family members, to the patients I look after in my office, to the family members of loved ones who I'm taking care of the ICU is please get your vaccination.
And Katerina, I can tell you that the vaccination rate in Windsor, Essex right now is continuing to lag behind the province. As of today, 81.5% of those currently eligible have gotten both doses. And across Ontario, it's 85%.
Thanks for this, Carrie. The CBC's Carrie Breen. The number of cannabis stores in Windsor is getting higher. The first shop opened up more than a year and a half ago in the city. And as Ash Tashetty reports, the number has ballooned to 30, with even more getting ready to open in the near future.
There is a lot of saturation in the market. We've seen it.
Shopping for cannabis is pretty easy along Tecumseh Road near Lozon Parkway with 4 options in just one corner. Fire and Flower Cannabis Co., Urban Bud, One Plant Cannabis Dispensary, and Shiny Bud are all located within 500 meters of each other. Experts and shops don't think that's too close.
If one of the policy goals, which it is, to get people transition from the legacy market to the legal market, the density of legal stores really matters. And I think we will see that in Windsor and throughout the province, that more stores equals more people entering the legal market, which is one of the policy goals.
Convenient access and the growing number of options on shelves is helping more consumers permanently make the switch to buying legally. Windsor police are seeing a ripple effect on the underground market.
We've seen that there was certain places where these illicit stores started to open, closed, and then reopened again, just down the road. But now, once you get 2 or 3, legal stores in that area, they've just closed up shop and have gone away.
But what's not going away are new shops. This map showing another 11 are seeking approval to open in the city. Legal shops say they're trying to stay competitive by selling new products like drinks and candy.
But we're really limited. There's a lot of regulations around marketing to differentiate ourselves from the other stores, where it's a little bit limited how we can do that.
There is just one limitation for entrepreneurs looking to open up a pot shop in Windsor. The store must be 150 meters away from schools. Now that still leaves a lot of room for the local legal cannabis market to grow. What industry experts say will happen next is more shops will open up in newer, less saturated markets like LaSalle and Amherstburg. Ashta Shetty, CBC News, Windsor.
The president and CEO of Hotel-Dieu Grace Healthcare is retiring. Janice Caffer has been the CEO for the past 7 years. She says the last 2 have been the most challenging.
But I don't know that people fully understand the weight of the responsibilities of making decisions for 1,200 souls and all of the patients and the families that depended on us. And the hardest thing was closing the doors to our family members early in Wave 1. We've worked hard to develop family presence here, and that was the toughest. I think that those early days of Wave 1.
Caffer plans on doing volunteering and spending more time with family. Current Vice President Bill Mara will replace Caffer. He says one of his top priorities coming in will be the new 68 mental health care beds being transferred from the Olette campus to the Tafor campus as part of the mega hospital project.
And it's truly getting the wheels in motion now. I think the waiting has stopped. We have a lot of work ahead of us. In fact, we have a call with the ministry tomorrow on that very announcement and what the next steps will be. So critical to the region, and we'll continue to support Windsor Regional Hospital with their work for the County Road 42 location, and also the repurposing of the Olette campus, which we continue to own, and that will continue to serve as a healthcare footprint of some sort.
Caffer will retire no later than March 31st of next year. She may retire sooner if the transition period goes faster than anticipated. Mara is expected to take over April 1st of next year. Some staff at 2 southwestern Ontario hospitals face termination today for not receiving a COVID-19 vaccine by their employer's deadline. Blue Water Health in Sarnia and the Chatham-Kent Health Alliance gave workers until October 31st to get their 2 shots. Today, Blue Water reported 18 staff members have not complied, and in Chatham-Kent, 26 staff and 1 physician have not complied. Staff members face termination by their employers, and physicians will have their privileges revoked. All 5 Erie St. Clair hospital organizations in southwestern Ontario have agreed to the same vaccine policy. The health unit is reporting 70 new COVID-19 cases over the last 3 days in Windsor, Essex. There are now 195 active cases. 2 schools are in outbreak. And later this month, the province says it intends to provide schools with take-home COVID testing kits. The interim medical officer of health says testing is a complicated clinical issue, especially for a mass community of people.
When you're testing a population or a community of people, you have to consider what the consequences of a true positive and a false positive are, and how you're going to manage both of those. So I know it's a long-winded and sort of a meandering answer, but I think we have to work on the facts and circumstances of when the test will be used and how it will be used. And I'm reluctant to order testing on people, on a community of people, unless we think that there's a public health benefit.
Windsor City Council is drafting a letter to the federal government asking they do away with testing at the border. Currently, a negative COVID-19 test is required to return to Canada, but Councillor Gary Kashuk says it can be expensive. He put forward a motion that the city ask the feds to remove the requirement. The councillor says other border towns have also made the ask. Windsor Council voted in favor of sending a letter to the federal government. The U.S. border reopens to vaccinated Canadians next week, Monday. A group in Leamington is working to find a solution to homelessness that's specific to a rural area. They've put together a report with recommendations like the need for more services in Leamington and emergency housing. Now they're working on a strategic plan to make some of those points a reality.
First and foremost, housing and homelessness issues just look different in a rural community like Leamington versus an urban center like a city. There are no emergency housing options in Leamington. The closest place for someone to access emergency shelter is in the city of Windsor. And housing and homelessness supports are also primarily located in the city of Windsor as well. So that, coupled with limited transportation options within the county, makes it really difficult for people to access the supports that they need. So these create massive barriers for accessing emergency shelter and supports. And that, coupled with the fact that homelessness is just more hidden in Leamington, meaning that people are more likely to be couch surfing or living in discreet locations like tents or their cars, makes it more difficult to connect with individuals than it would be if they were sleeping rough outside. A few of the things that we're working on right now, as it stands, those who are experiencing homelessness or housing insecurity should get in touch with us through the Windsor Essex Housing Connections program. And then in terms of real, tangibles that I see as realistic possibilities for the future, I know I said we're not looking at a standard shelter model, but we recognize that there is a need for some sort of emergency housing in Leamington. So that is something we're looking at. We're not saying it'll be an emergency shelter or nothing, but just sort of looking at what makes sense in our area. And then, affordable housing is something that was mentioned a lot in the survey. I am no expert on the feasibility of affordable housing in a community, but I do think that if we are to seriously consider lifting people out of poverty and homelessness in Leamington, that is a need that needs to be addressed. People just want support close to home and want to feel empowered to access those supports.
Live shows are coming back to Caesars Windsor in December, and it's a hopeful sign for local musicians.
For sure, mentally and financially for musicians, it's a big glimmer of hope. Like I said, it's coming back, and we can only hope and pray that it keeps coming back and things stay on course.
He's booked to play the casino next month. The Coliseum, the larger venue, will also open that month. CBC News wanted to know what folks in the community think about taking part in big events once again.
Just the people, the music, it's a good environment, like the vibes.
Live shows, I think people are ready to start coming back out. I think a lot of people are vaccinated and taking the proper measures. I think it'll be pretty cool. I think it'll be fun.
Especially after, the last 2 years of everything being closed down. I think it'll be good for Windsor, and it's exciting, kind of life going back to normal a little bit.
That return to normalcy is something so many of us are craving. Can't remember the last time I was at a live concert. Feels like forever ago. A live look outside there. We got some cloudy conditions tonight and then a chance of showers for tomorrow. Nick Cirkovich will be here right after the break, and he will have your full weather forecast for the week. Stay with us. Welcome back. NHL Commissioner Gary Bettman is publicly apologizing to former Chicago NHL prospect Kyle Beach for the trauma he endured, but has defended the league facing the scandal involving the 2010 sexual assault allegation. An independent third-party report last week stated that the team largely ignored those allegations. Last week, the team's coach and Windsorite Joel Quenneville resigned. Bettman says the NHL will review its policies and do what is necessary to move forward.
As I told Kyle on Saturday, I am sorry for what he has been through and thought he has been courageous, especially this past week. We discussed the path forward with him involved in efforts to confront abuse. We also offered to him and his family our resources for counseling.
World leaders are in Glasgow as the UN climate summit talks get underway. COP26 is being billed as a turning point and a make-or-break moment to avert a global catastrophe. But millions around the planet are closely watching for concrete actions that go beyond words. When it was his turn today, Justin Trudeau stepped forward to unveil Canada's role in tackling the climate crisis. David Cochrane reports.
World leaders gather in Scotland with a sense of pessimism in the air after the G20 nations failed to agree to firm commitments on phasing out domestic coal use and hitting net zero. This summit is on the brink.
It's 1 minute to midnight on that doomsday clock, and we need to act now.
The UN has been hosting these conferences for a quarter of a century, but the last 6 years have been the warmest on record. Existing climate plans aren't seen as ambitious enough, and the goal of keeping global warming to 1.5 degrees is in peril.
Enough of treating nature like a toilet. Enough of burning and drilling and mining our way deeper. We are digging our own graves.
Or, in Canada's case, losing entire towns.
In Canada, there was a town called Lytton. I say was because on June 30th, it burned to the ground.
Devastated by raging wildfires, the Prime Minister raised Lytton as a cautionary example.
Net zero.
From a country that comes to COP26 as both a climate champion and contradiction. A country with a national carbon price and a firm commitment to net zero, but with a large oil and gas sector and a government-owned pipeline.
Which brings me to my next major commitment. We'll cap oil and gas sector emissions today and ensure they decrease tomorrow at a pace and scale needed to reach net zero by 2050. That's no small task for a major oil and gas producing country.
That's a commitment Trudeau made in the last election, and he's asked a panel of advisors to come up with a plan to make it work. Trudeau also announced that $1 billion of previously announced funding will be used to help developing countries transition from coal to clean energy. David Cochrane, CBC News, Glasgow.
Nick Sirkovich joins us now for a look at our weather forecast. Nick, it is the first day of November, and it feels like the first day of November.
It does, yeah. We've got the winds, we've got temperatures that are kind of dropping. Definitely feeling it as we get on the other side of Halloween there. We've got temperatures that are sitting in the single digits across southern Ontario. Round about or just about a degree or two below the seasonal mark for today, but we're actually going to see some sort of cooler temperatures heading into the next few. It's also being windy as well. There's a look at current wind gusts. Some stations not reporting gusts, but generally today we've seen gusts in the neighborhood of about 40, even approaching that 50-kilometer mark, and it has come with some cloud cover across the region. So that's basically the stories we head through tonight. Now, moving through the overnight period, we're looking at partly cloudy skies into tomorrow. We've got a slight chance of seeing some isolated spotty showers. Most of that should really be sort of east of London, but I still think we've got the chance of seeing it down around the Windsor area as well. So I'm going to keep that in the forecast. Then on and off cloud cover as we head through Wednesday as well. And basically this is the story that replays for the better part of the week. Generally speaking, a mix of sun and cloud, but we've got cooler temperatures in the forecast. Now, in terms of the winds, we've got winds that are going to be gusting close to about 40, perhaps even 50 kilometers per hour coming up over the next 24 to 36 hours. After that, they begin to peter out, but certainly through tomorrow, still look for some breezy conditions that continue down in southwestern Ontario. Temperatures for tonight. You know, it depends where you are. Some areas are actually going to see temperatures below the 0 mark. Windsor, looking at 2 degrees here. A couple of reasons for that. It's really kind of the cloud cover, and also just because of the city itself, we get a little bit of an urban heat island effect. But as soon as you get out into some of the rural areas, we're looking at temperatures that are going to be at or just below the 0 mark for tonight. Now tomorrow, we've got temperatures, again, a couple degrees below the seasonal mark, a mix of sun and cloud, about a 30% chance of seeing a few spotty showers there. It is going to come with some gusty winds as well, though, gusts up to about 40 kilometers per hour. Cooler conditions prevail right through the week, mix of sun and cloud all the way into the weekend. So by and large, not a bad fall forecast, but you're going to have to bundle up. Our overnight lows, even in Windsor, touching the 0 mark, as we head through tomorrow night.
I've been avoiding the winter clothing, but I think it's time.
I know.
Gotta prepare. Thanks for that, Nick.
You bet.
When we come back, we have a story for you about how a London area mom saved Halloween for more than 100 kids. So that's right after the break. Stay with us. The U.S. Supreme Court heard challenges today to a new restrictive Texas law on abortion. It bans most procedures at about 6 weeks once a fetal heartbeat is detected, which is before some women even know they're pregnant. Freelance reporter Tony Waterman has this report from Austin, Texas.
Abortion is healthcare. Healthcare is a right.
These are two separate cases, but the lawyers for both the Biden administration and Texas abortion providers essentially made the same argument, that this law not only brazenly violates Supreme Court's precedents, but also a woman's constitutional right. But the main focus of Monday's oral arguments was not about the law's constitutionality, but rather the way in which it has been crafted. Unlike every other law on the books, Texas's abortion law is not enforced by state officials, but by private citizens who can sue anyone who helps a woman get an abortion, even Uber drivers who bring a woman to an abortion clinic. And these plaintiffs stand to win $10,000 or more if their case is successful. The U.S. Solicitor General said it was structured to intentionally prevent federal courts from doing their jobs.
States are free to ask this court to reconsider its constitutional precedents, but they are not free to place themselves above this court.
And because it is so unprecedented, the Biden administration argues it requires unprecedented action from the Supreme Court to intervene. But the conservative members of the court were very skeptical of this argument. Meanwhile, the Texas Solicitor General, Jude Stone II, argued that the government and abortion providers at this point are just suing the wrong people. Now, the court is expected to issue a ruling swiftly, perhaps even by the end of this week. That will clear the justices to take up a Mississippi law next month that bans most abortions after 15 weeks. That is a case where abortion opponents are explicitly asking for Roe v. Wade to be overturned, that landmark ruling enshrining a woman's right to an abortion. So we will have a better understanding then how this conservative majority court could move forward on abortion law. Tony Waterman for CBC News, Austin, Texas.
A London area mom helped save Halloween for more than 100 kids who had to cancel their trick-or-treating plans. The children who attend a local elementary school in Lucan, Ontario, just north of London, were forced to quarantine after a COVID outbreak at the school. And that's where Taryn Pistoka comes in.
I was incredibly sad to hear the news that there were going to be so many kids in town that weren't able to participate in Halloween this year. So it kind of started around Thursday afternoon, Thursday evening, when we were hearing the news of more and more kids that were being affected by the positive cases at our public school here in town. And I just can't imagine having to tell my kids that news. And we're very fortunate that we haven't been affected. So I figured because we weren't affected and we have the ability to help them, I just thought we could help make their day a little better.
In just 3 days, Pistoka organized goodie bags with the help of her friends and community donations. They ended up delivering 158 goodie bags, and Pistoka says she's received a lot of feedback from grateful parents. That is it for CBC Windsor News. Thanks for joining us. Have a wonderful night.